Hi, my name is Ciaran Nicholl. I work for the European Commission's Joint Research Centre, and there I'm the Director for Health and Food and also of the GRC Gale site. Thank you for the interview. The main cancer-related issues we should tackle are addressing the inequalities, raising the bar of essential standards. That's why in the European Commission and in the EU we're working together with the Europe Speeding Cancer Plan and the Mission on Cancer to provide essential levels of quality care for the 6 cancer sites that are causing the highest burden. That means over 50%. If we can raise the bar of essential standards, not to lose the patients between the stools of the healthcare pathway, between diagnosis and first treatment, follow-up care, multidisciplinary meetings, evidence-based knowledge, then we will tackle this disease, this formidable disease, like never before. And there's no rocket science behind it. It's about working together in quality assurance schemes that are applied equally and monitored using our cancer information system, using our inequalities registry, so we start lifting up the level of care. That is our main objective, to join the dots, to bring all this together in one, working together. I think first of all, to reduce them, we need to expose them. So that means to show the unacceptable disparities and inequities that persist also within countries and between countries. We have good practices. We know about what to do and even how to do it. So when those disparities are exposed, using European values as a driver, we should then go to those member states and support them with whatever we can to bring up their level. If it's turning up to a screening program, you've heard today that maybe in some Eastern European countries the screening is in bad shape and we need to lift it up. It is true. If 8% of women are turning up for screening of the right age category for breast cancer screening, this is terrible, really, really bad. So yes, we need to work together to bring up the levels, and we know what to do. So that's where governments and policymakers and physicians and experts and the EU can work together to do that. And also, we should look more into public-private partnerships. I think the two worlds need to come together and to drive the future. And taking care of citizens' health and patients' health is one of the most important things we can do in this crazy world of ours. Policy recommendations, the council recommendations are, of course, a key player. I think the will from the politicians is there. I think what we've been maybe a little bit weak at was coming up with the best guidelines or the best knowledge, evidence-based, but now to actually implement it on the ground where it counts. That is the new political direction. You've heard of, Mario Draghi and competitiveness. We are great in Europe for producing technologies, for producing evidence, for producing research. But how good are we in actually making it work on the ground where the funding comes from ultimately? So I think that's the political directionality. The winds are turning in the right direction, and we will be pushing in every way. Any project we do, how can that help the people, the patients? And that's the key driver. So that has to be a number one priority. No, just the wish. My ambition is to unite. I think if you look at the Knowledge Centre on Cancer, there we have a little tool where we show all the European Union projects that are working on cancer in one place, so you can see the connections. If we put our shoulders together behind this wheel called Tackling Cancer, we can make tremendous project. We need to not end the fragmentation, we need to connect the dots. What everybody's doing is great. It helps. But are we unleashing the potential of the collective knowledge? That's where the European Union and the Commission and the Joint Research Centre can come in with its platforms and gateways and portals and systems to pull it together. You have the European Health Data Space coming, European Science Open Cloud, you have many initiatives. So I think now is the time we need new research, but we also need to use what we have. So that is my ambition, that we pull together what we have and to unleash its potential. Thank you.